Good evening, everyone. It's 7:03 on July 20th, 2026, and we're starting the Board of Health meeting. So call to order, 7:03. That's number one. Number two is citizen speak. Is there anyone that would like to participate in citizen speak? And I don't see anybody that has entered the room. So we'll move on to number three, approval of the minutes. And we have 4 sets of minutes to approve tonight. April 13th, April 30th, May 6th, and June 1st. And if you would, board, take the April 13th minutes and take a look at those and let me know if you have anything you'd like to change or correct, edit. April 13th.
I read them earlier. It's fine with me.
Same here, Caroline. I read them and they're fine to me as well.
I wasn't on the board yet, so
So I move to
Yep.
I move to accept the minutes.
And Mary seconds. All in favor?
Aye.
That's great. That's approved. Okay, we're going to move on to the April 30th meeting minutes. Take a look at that, board.
Again, I have no problems with them.
I read it as well, Caroline, when you dropped it off. It's okay.
Yep, no comments either on my end.
Okay. So I move to accept the minutes.
I'll second.
All in favor?
Aye.
Okay. The next one is the May 6th meeting minutes.
Again, I have no problem with them.
Same here.
It's fine with me.
Okay. So I move to accept the minutes.
I'll second.
All in favor? Aye.
Aye.
Great.
Okay, now the last one is the June 1st meeting minutes.
Fine with me. Do you have any problems?
Looks good.
No,
Okay.
looks good.
So I'll move to accept these, make a motion to accept these minutes.
I'll second.
All in favor? Aye.
Aye.
Thank you for approving the minutes. Moving along to number 4 is 464 Granite Ave. Eyebrow microblading by Nirmala from Narayan, Malroy, PMU. She's requesting a variance regarding a mop sink. Discussion and potential vote to approve. And I'll just remind the board, and Deborah wasn't here for this, is that we had 2 other establishments. It was a Dr. Eyebrow many years ago, and recently John Toddy Scalp Designs. Neither one of those had a mop sink at the establishment. So when Carolyn and I went to see this new establishment, we realized there's no mop sink there either. And previously we had allowed Mr. Toddy at Scalp Designs and Dr. Eyebrow to use a Swiffer instead of having the mop sink in their establishment. And they could use the Swiffer on the ground if there was any blood or bodily fluid that happened to splash on the floor, which would probably be rare, that they could use the Swiffer, pick it up, and then put it into the biohazard bag, the red bag, and dispose of it properly. Does the board have any questions about that? So it was approved before in 2 other establishments that they could do this.
I don't have any questions. I'm fine with approving this, seeing as we've done it twice before.
So I'm fine with it too. My question really is about sort of standard practice. So What would be a circumstance where we would require it? And should we just remove it? Should it just be removed from the requirement in the regs, or should we keep it in and continue to make exceptions as needed? It's just kind of a standard practice question.
So it is in our regulations that they have to have this. And I think the regulations probably came from another town, because every town can make their own regulations according to these microblading requests that are coming in. So we probably copied it from like Cambridge, and it must have been in there about the mop sinks. So, we've only had two. Now this is the third one that's opening, to realize, wait a minute, there is no mop sink in the establishment. And then we said, okay, you're allowed to go for a variance. And so you can use the Swiffer instead. So those are the regulations that we have in place, and they're in the plan review too. So when we go in and we look at the establishment, we notice either they have it, they have the mop sink, or they don't. So maybe the next one will have the mop sink, but I'm not sure.
Well, maybe we could amend it to say mop sink and or use of a Swiffer, so that people don't have to come in for a variance
We could do that.
unnecessarily.
Mm-hmm.
So we can take a look at the regulations.
Laura, that's a good idea.
Yeah, I think that's a good idea. Now, Caroline, another question. Should I wait a minute, or should I lower my hand? I'm just going to do that. How about the biohazard bag? Like, do they have a contract with a company that picks those up, and where is that kept?
I'm going to let Nirmala speak to that, but yes, she does have a company that comes. Nirmala, do you want to answer Mary's question?
Yes, I do have a Metal X waste company to come in to pick things up when it's filled. And doing microblading is actually, you won't be seeing things flatter to the floor. It's just like on your eyebrows. It's not much coming out of your eyebrows.
Right. Thank you for answering that.
You're welcome.
Do we have any more thoughts, or should we? I'll move to grant the variance regarding the mop sink.
I'll second that.
All in favor? Aye.
Aye.
All right,
What
so
do we
that's-
do with what do we do with the recommendation to tweak the regulation language?
So I could bring that up at another board meeting if you want me to. You guys can look at it.
Yeah, that's a good idea.
Yep. So I could do that.
Okay.
And you can look at the regulations and see them for yourselves.
Mhm.
Put that as a note.
Thank you for
Thank you.
That's
approving.
great.
Okay.
Makes
so-
it easy for businesses.
Okay. How's everything going, Nirmala?
It's going good. I just started, but I haven't having clients yet because I just opened. I'm trying to do like promotion and stuff going on. I'm just waiting for you guys to come down and have something down your eyebrows.
It'd be a beautiful shop there. Beautiful. It's really, really nice.
Thank you.
I hope you do well.
Thank you.
Nirmala,
Thank you.
wishing you the best of luck.
Thank you guys. Thank you for approving my variance.
Welcome.
Thank you.
Okay. Good luck.
Thank you.
Take care. Okay. All right. Let's see. Now we're moving on to number 5. Board of Health Medical Advisor Roxanne Musto, discussion and vote to have Roxanne continue in this role as she signs all our standing orders for the medications, emergency orders, and vaccines. So, Board of Health Medical Advisor Roxanne Musto, discussion and vote to appoint her to continue serving in this volunteer position. And I did a little background history about this position too that I'd like to share with the board. And I looked through some of our meeting minutes that in November 18th, 2013, Roxanne Musto suggested to have Dr. Campagnoni be the medical advisor for the Board of Health. Now, he was her pediatrician for her kids, so she knew him. And this was discussed at a board meeting that she was going to ask him to volunteer for the position. This was November 18th. So I look back in the minutes and there was no formal vote taken to appoint him. It was just an internal discussion about it because this is a volunteer position. And he did say that he would come on as the medical advisor. And Dr. Campagnoni stepped down. He resigned on January 10th, 2022. And at that time in 2022, Roxanne said that she'd continue in that role because she's a nurse practitioner. And she said to me, because I said, like, who's going to be signing all our paperwork? And she said, oh, I'll continue on. And I will sign all the paperwork that needs to be done. She said she's up to date with her licenses. She has her license to prescribe medications and also help us with our emergency orders, our state vaccine program. She has to sign it as a medical director for that. She's been doing that since 2022. She signs the prescriptions for the EpiPens, over-the-counter medications. And it has been like an internal process. We're happy that Roxanne volunteered to continue on doing this, and she's been doing it since Dr. Campagnoni left in 2022. But we'd like to make it more formal, have a formal vote to have Roxanne continue to sign these medical orders because we need somebody to sign the orders. And she agreed to do this. She said, yes, I will agree to stay on and be the medical advisor. She's been doing it for the 4 years. And, it was recommended that, yes, we should vote for this. We should formalize this. We hadn't formalized it with Dr. Campagnoni. We never formalized anything. It's kind of been just like an internal discussion with the Board of Health members. This is a volunteer position. No one's getting paid for it. We're just volunteering to do this. So I'd like to open it up to have some discussion and then a vote.
Well, I don't have any problem with Roxanne. When do we need this? Like, when do we need orders signed usually?
So usually around September, we get the vaccine and then we have to have everything signed.
Mm-hmm.
Like, and internal signing too, like we submit paperwork into, it's called like MIIS. It's a registry of all the towns that do the vaccines. We do the Sanofi vaccine. So we have to internally put in papers to say like that we have a medical advisor. I think she signs it actually as a medical director to say like, yes, we have this person in place. We have to say that we have to have this. It's called in 2025, and she signed it in 24, 23. It's a 2025 agreement to comply with the state vaccine program. And the state vaccine program is for the children. So we get vaccine from the state for the children. We also purchase vaccine from Sanofi. So we need to have that done because the flu clinics are coming up in about a minute. Yeah.
Mm-hmm.
Start planning for that.
So it's important to get it done.
Yes. Yeah.
Okay. Does anyone have anything else to add?
No. I think Roxanne could continue to sign orders.
Well, I'll make a motion to.
Oh, well, I'd like to.
Oh, I'm sorry.
I was letting Mary go first. First of all, let me just say, I never formally said this at the last meeting because Mary, you weren't there, and I wanted to make sure we were all here. So Roxanne served the board for a really long time, and I just wanted to thank her for that. And this is one more thing she's volunteering to do, and I wanted to thank her for offering to do that as well, even to continue even after not being on the board. So I just want to thank her. I think civic engagement's really hard and volunteering is really hard, as you all know, and she's done it for so many years, and regardless of positions or whatever, it doesn't matter. It's hard work. So I just want to thank Roxanne for all her years of service. And in that vein, thank her for volunteering to continue doing Board of Health related work, even after she's not on. So I just want to acknowledge and appreciate her and thank her for doing that. So I also did some digging. I didn't have much time because, as you all know, we just got the minutes, maybe 1 or 2 business days ago, and then we have the meeting tonight. So I did some quick digging also. As you said, the previous medical advisor was Dr. Campagnone. He served for 8 years from 2012 to 2020. So I realize this may or may not be lining up with some of the dates, but this is sort of some of my digging I came up with until he stepped down. And I actually had the pleasure to chat with him because I'm still learning the ropes here, even though I've been watching meetings for years. I'm still learning the ropes. So, and I actually also, my pediatrician's office also is where he practiced for many years. So, so I know him, and I called him and picked his brains and asked him for his experience and what he recalls was the process for being appointed. And he actually recalls being appointed by the select board. And he remembers submitting a letter of interest, and he remembers submitting his credentials and his resume. And then later, when he resigned, he was asked to submit a letter of resignation to the town clerk when he stepped down to make it official. And so what I was going to recommend is, and Caroline, I actually agree with you. I do think we should make it formal. I'm glad you feel that way. I agree with you. So what I would like to recommend is that we follow the standard practice for appointments of medical advisors previously, and volunteer appointments in general. So if it did go through the select board, I actually tried to Google it and look it up, AI it, and I went to the website on the town website, and it looks like the town minutes don't go back before 2016. So I wasn't able to find documentation from 2012. And so what I'm going to recommend is we follow if the appointment process that select board does routinely, which is ask for letters of interest and credentials and resume. And it would be great if Roxanne wanted to continue as a volunteer in that position until we're able to open it up for a transparent and public process, and then she can apply, and maybe she'll be it anyway. But I just want to get sort of the public transparency, formal standard operating procedures of how you do appointments. Now, I don't know if the Board of Health can do that vetting and receive the letters, or if it has to be the select board. We might have to ask town council, because there were a handful or several, I don't know how many medical advisors, I don't how many years going back. I know there was one prior to Dr. Campagnone, which Caroline, you all probably remember. So there must have been some standard practice. So that is my recommendation. And I have a couple of questions. One is if there's a job description for it that exists, or if we would have to create that volunteer job description. And the other is that you said that that she had signed an agreement, that the medical advisor signs an agreement to comply with state vaccine programs for children. And I'm wondering if that agreement applies to adult vaccine protocols as well for the state.
Carol,
I can answer some of that first, Mary.
Yeah, and then I have a couple of other things to say after you answer that.
So it doesn't apply to adult vaccine, not this agreement that I'm talking about. That's just only for children. So that agreement that we send into the state, there is no standard practice, and we don't have any formalization regarding, you're talking about job descriptions and stuff like that. We've never done something like that, to my knowledge. We didn't have anything like this for Dr. Campagnone. He just volunteered to be the medical advisor. You said that the select board, he sent his resume and things to the select board, but the select board doesn't oversee the Board of Health. The Board of Health is a separate entity. So the select board is separate from the Board of Health. The Board of Health can make regulations, they can make appointments on their own, and the select board would never have been involved.
Yeah, that makes
involved into it because the Board of Health is their own entity.
So you think he was mistaken?
I think he's probably sent it into the health department, but I don't remember him doing that. I didn't find anything like that. I looked around the minutes, but I didn't see it. Did he send it someplace else? I don't know, but yeah, I know that he wouldn't have sent it to the select board because they're their own separate. Go ahead, Mary.
Yeah, that makes sense. So I was going to just finish one more thought, and then I'll stop. The other thing I want to say is that it was actually really interesting to chat with him because his role entailed much more than just signing papers. He said that he also advised on medical topics, like when BU did the airplane pollutant study. He said he chimed in. He attended Board of Health meetings that you guys dropped off packets for him, and he attended meetings. And he said he also chimed in around COVID best practices. Mm-hmm. And so he was saying he actually from time to time would chime in. So so just the two things, it would be really good to get just a job description of the expectation and also to go through and to go through a transparent public process where we request letters of interest and get credentials and resume. And then the board, because it sounds like maybe he was mistaken and it just went through the board, and then the Board of Health can vote on it. And of course, Roxanne is welcome to continue, submit a letter of interest. So I do think it would be a good idea just to kind of open it up to the town. So go ahead, Mary.
Okay. Now, Roxanne's role as the medical advisor doesn't expire because we had a new appointed board. Her, Dr. Campanoni or whomever, like Roxanne has been on a continuum, and so was, when just because there was a new election, we didn't get a new person. They continued to do it. They fulfilled their role before, and they did it in a competent way. It's on a continuum. There's no expiry.
Right. I understand what you're saying.
Yeah, it was just internally. We would have the volunteer internally.
Yeah, and it was just we said you're it, and it continued on until they said I don't want to be it anymore. So there wasn't any yearly.
Dr. Campanoni, he's my pediatrician too, and he retired, so he was giving up his medical license, so he could no longer sign. He's no longer has his medical license, and he just volunteered to just retire. He was retiring purely. He's like, I'm just really retiring. And it was like, oh, please don't. But, he did. And that's kind of why he couldn't, he couldn't sign or advise anymore.
Right.
Caroline, can you say more about the document to support the state vaccine standard practices for children, but not adults? Is there a separate document she signed for adults, or just there's no agreement to support the adult statewide standards?
So I'd have to really dig that out, Deborah, to find it. I'd have to do some. Yeah.
Well, no, does the state give us the vaccine for the kids?
They do after you sign this agreement. So
right, but we buy the others, so we're probably not required to sign anything.
Right, we buy others, but if they said like, I can't buy Sanofi vaccine, you'd have to have someone who has the those,
Credentials.
she's credentials. Yeah, so that's why she can do that.
Wait,
Yeah.
I'm sorry. Are you saying that the state gives the town of Milton vaccines for the kids, but we have to buy the ones for adults?
Yes.
And is there anywhere where the medical advisor has to sign just in general that they'll uphold the state standards in general?
Yes.
Not, I mean, all public health practice state. Like, what is the language for that?
So I'm trying to understand your question. Can you repeat
It's
it?
the Nurse Standards Practice Act that covers all nurses. It's a law.
She's
that
a
what
licensed
you're getting
practitioner. I don't know. Yeah.
So you're saying that she signed a document agreeing as a medical advisor, and that all our medical advisors sign a document saying they'll uphold the state standards of vaccine protocol for children, right? Because we're getting it from the state. In any of her documents, does it say that she'll uphold just general vaccine practices for adults and children in her role in general, or just general state recommended public health practices in general?
Well,
In other,
I'm sorry, go on.
So,
like,
So
what
yeah,
other
to be-
documents has she signed? I should say, what? So what other documents has she signed?
Well,
So
she
she's-
signs for
she's-
the adult vaccines too, doesn't she?
Yes.
Just not
she signed standing orders
to
for
get
all the
it
vaccines.
for the
Yes.
orders.
We have to have the standing orders. And I told you last week, like emergency orders or EpiPen. She can prescribe the EpiPen because if someone had a reaction, we could give them an EpiPen. So she has to sign all the orders. Yes.
So I apologize. Thank you for walking me through this. So the medical advisor doesn't have to sign when they take on the role unrelated to the specific issue of vaccines, because actually the role is much larger than that. As I mentioned, they also advise on COVID, he advised on COVID practices and the pollutant study that BU did around airplane emissions. So it's a bigger role. So I'm just curious, what are there forms that the medical advisor signs where they say they'll uphold state standards around public health best practices, just in general? It's just kind of a higher level question.
So I don't recall, Roxanne didn't sign anything like that, or Dr. Campagnoni.
No.
What
Well,
she-
also Dr. Campagnoni, when he would give his opinion, we didn't have to follow it. That
Right.
was just, he was not a voting member of the board. So, and there were times when we did not follow it. I remember one time during COVID in the gym wanting to stay open but he's not the medical advisor cannot vote, and we don't have to accept any of their advice.
He's just advising. Yes.
Yeah,
If something comes up, he can say.
the point is really to sign the orders.
Right.
Okay, got it. Thank you. That's very helpful, actually. So maybe I should reframe the question. Are there any forms other than this vaccine thing that the medical advisor signs as an agreement of best practices when they become the medical advisor? Are there any forms in general other than that one agreement around the children's vaccines?
I think their code of ethics for their profession, like I said, the Nurse Standard Practice Act covers you on what you're saying, I think. I'm pretty sure.
Okay.
It's a state law, like it's a big, long document, and all nurses have to abide by it.
Okay, so let's move on. But I think part of my recommendation is that we, as you say, Caroline, I love that we formalize this and that we open it up, we create a job description, and we actually, like, here moving forward. I know we haven't had any process or protocol in the past, and it's been sort of informal within the Board of Health. But I think what I would recommend is that we create a more formal process at some point in the future. The current person, whether it's, however many years that might be, we're going to need to change it. So my recommendation would be, as part of that we work on what that would entail. So it might entail a letter of interest, it might entail credentials and a resume, it might entail signing forms that you'll uphold standard practices for the state of Massachusetts, that kind of thing. And then it's transparent and open, and anyone who's interested could apply, sort of thing. And it might be that, and I actually am open to the idea of her continuing to serve in the role until we do some more formal process. It's fine with me.
I think before we did that, maybe Caroline, you could talk to town council, because if we're doing that, does that make it more of a role legally? And, I just don't know if it's acceptable under that. By having a written job description and it's one thing to okay a resume and say, okay, that looks good. But I don't know that it's necessary to have a job description. They're not an elected official. They're not getting paid. They're,
Right. Volunteering. We have people that volunteer.
They're an advanced practitioner.
Yep.
Sorry.
We have people that volunteer on our flu clinics, and we don't say, send me a job description.
Right.
Yeah.
They just, and I don't know if it's going to, I just wouldn't do anything without checking with town council, because it could just open a can of worms. Who knows? And we've never done it before.
Right.
That would be great to check, because although I appreciate that there hasn't been a process or protocol before, but it's always sort of good practice to put them in place. So then whenever there's a turnover, there's just a standard practice to do it. Also, as I said, I think an expectation of the role should be written out, because, as I said, it's not just the flu clinic. It's advising on other topics that might come up, like a pandemic or, airplane pollution, that kind of thing. So it is sort of a bigger role based on my conversation with him. And the truth is we could, anyway. So yeah, that's just my recommendation.
Well, at this point, I think, why don't we vote? Well, I'm inclined to vote Roxanne in now, and if you could check with town council on whether those things are necessary, because then it may open a can of worms that you have to do it for every volunteer position, and it would be very time consuming. And then we can look at what other towns are doing and go from there. But for now, we need a medical director right now. And I think we should take a vote on that now, because we'll need it for September. We don't generally meet in August. So I'm going to make a motion to appoint.
Well, hang on. I just want to make one more comment. Sorry. Actually, I just want to really clarify my request. I'm not asking for a written protocol and process for every volunteer. I'm only requesting that we create one just for the medical advisor position and no other. So I don't think it'll snowball.
No, but
it's a very specific request.
Right,
and
but I just want to make sure, and that's why I should be checking with town council, that it wouldn't, by doing that, it wouldn't require her to do it for any volunteer, like for the flu clinics and what have you.
And if town council says it's really better to do it for every volunteer, then it's probably prudent to follow town council, and instead of not doing a protocol for anybody.
Right, but I think if you do it for one, you may have to do it for all, opening up an unnecessary amount of work for someone who's volunteering at a flu clinic. And it's just always best to check with town council.
Yes, agreed. But if town council's suggesting it, then it's not unnecessary. You know what I mean? Anyway, but we can explore it, and we don't have
Laura
to make
is
any.
legal counsel, so I respect what you say, Laura, and
Well, I just want to make sure.
motion for
And
your,
I think at this point, we should,
Yeah, agreed.
I move to appoint.
The last comment I'll make is just to say that Roxanne was doing that in her position as a Board of Health member, and she's no longer a Board of Health member. And so I think there does need to be a transition demarcation, because I'm like, why was it on the agenda? If like, why now then? And I think the reason is because she's no longer on the board. So there needs to be like a vote or discussion to make it more formal. And so it's not
we
just
never voted
continuing.
on, we never voted on Dr. Campanoni either. And he wasn't on the board. So this has
Right.
been going on for time immemorial. And,
No, right.
you know,
Exactly. But I'm saying, why now then? Then why is it on the agenda tonight then?
Because we're formalizing
we're
it.
talking about it and
We're
formalizing it.
going to vote on it. So in 2 years from now, you would say, why is Roxanne still signing things? Oh, because we need those signed. We need them signed for the flu clinics, for our standing orders. So we need to put this on the board meeting, so we're formalizing it.
Right. So what I'm suggesting is that the reason we're formalizing it is because she's no longer on the board, and that the medical advisor role, she was serving as a volunteer while she was on the board, and she's no longer on the board. So there is a transition period. The other thing is, I looked up on the town website and it doesn't list her as the medical advisor. And I looked up on the previous couple of years, or the most recent annual report, Caroline, that you wrote and posted on the website. And it doesn't list her as the medical advisor either, which sort of gives more credence that if this was really very informal. And so I'm suggesting that we do formalize it. So I really appreciate you having the opportunity to have the discussion. I really do appreciate it.
Yeah. So we'll formalize it now. I move to appoint Roxanne Musto as the medical advisor for the Board of Health.
I'll second.
All in favor? Aye.
I don't agree. If it's not temporary, I'll vote yes if it's temporary until we put in place letter of interest and all of that, like a proper, more formal. Because we're voting informally, and so I'm requesting to consult with town council first. You had suggested this to consult with town council, so I'm wondering if we can hold off on this vote until we consult with town council, maybe, and we vote on it next meeting.
We'd have to reconvene on another meeting, and we just voted on it. So
well, I didn't vote. I didn't.
No, I know you didn't, but Laura had said you'll defer to town council and get.
So we voted and then we're going to defer to town council. I was hoping we could defer to town council and then vote. No,
I was referring to talking to town council about setting up a job description and requirements and what have you. And that's all. But I think we do need to appoint one before September, and this is our only opportunity to do it. It can go forward in a 2-to-1 vote. I mean,
that's true. I'm happy to meet next week. I'm happy to meet anytime in the next or this week, even after town council has been consulted. I'm also happy to vote in support of her being the acting advisor until we can get a more formal process in place. So that's my.
So you're a no one voting it in then. So, but 2-to-1 makes Roxanne. And then when we speak with town council, he determines there's some sort of problem, then we'll have to reassess.
Sure. I don't agree with the process and the order, but I respect the vote, and
Mhm.
and I appreciate her volunteering, even though she's not on the board anymore.
Okay, great. Well, thank you, and we'll see what happens. But as of now, she is our medical director,
Advisor.
advisor. Thank you.
Can we also agree to work on a job description, or you're saying that?
Well, let's talk to town
along?
council and see what
Right.
happens and see, we just, and then we can do that.
So if town council says we don't need a formal process or we don't need a job description, can we as a board discuss having a job description, even though it might not be required?
Well, we can ask town council.
Ask town
That's-
council.
Yeah, while you're asking, say if we don't require it, is it, I mean, it probably is, but I don't know for certain, so we'll just run that by town council too. How's
So you'll
that
have to
sound?
make a formal vote then, Laura. Again, I think because Deborah has to weigh
Oh,
in.
vote no.
So, yeah.
Okay, so I move to appoint Roxanne Musto as the Board of Health Medical Advisor.
I second.
All in favor? Aye. All against?
I
Okay.
vote no.
Okay.
Okay, moving on, and I'll get that information and let you know. Moving
Okay,
on to
thanks, Caroline.
Thank you very much.
the appointment of the new regional public health nurse, Allison Brum. Let's see. New regional public health nurse, Allison Brum, discussion and vote to appoint Allison Brum as an agent of the Board of Health. So this is a regional position, hoping that Allison, so this is through Norfolk County 8, that she can come and assist us with the new program regarding the maternal and child health program that we're hoping to roll out. And so she's working with all the towns to set up this going forward. That's her main job description, to do something like this. So we're happy that she's come on board. She's come once into our office so far, but I wanted again to formalize it, which we do with all of our appointees and their agents of the Board of Health. So I hope you vote for Allison Brum.
So she wouldn't be doing the maternal and child health outreach. She'd be training whoever the health department hires to do that.
So she'd be working with this, and I sent the job description over to Carla Feed for the maternal and child health 4-hour position that the health department is going to have a nurse per diem as needed, 4 hours. So she's going to be working like hand in hand with this 4-hour person. So she's kind of building it from the ground up, this program.
That's very exciting. Congratulations on that. For moving forward. But is she in maternal and child health? She has expertise in that?
Yes.
It's very exciting that when I saw that, I was very excited to see on the other, not this one, but the other one that you're moving forward with that. That's great. Yeah, I'm in support. That sounds great.
Okay, so do we vote on this one?
Yes.
Okay, I vote to approve Regional Public Health Nurse Allison Blum as agent of the Board of Health. All in favor? Aye.
Aye.
Great.
Okay. And then number 7 is discussion and vote to approve fines for sanitary code violations and minimum standards of fitness for human habitation. So we worked with town council, KP Law, Alex Weishut, and he came up with the templates that you see in your packets.
Right.
And why we asked for this is because we encounter, neighbors calling and saying, there's garbage, or there's sofas, or environmental complaints of neighbors, and then we send out letters, and then nothing happens. So nothing happens, and the letters go ignored, and no one calls us, and then we send out a second letter, and then we send out a third letter. So we don't have any kind of teeth to say, like, we'll work with you, but no one calls us. And in the letter, we say that, like, we're going to work with you, or call the health department. And so we've been spinning our wheels for years. And I reached out to Nick Milano, the town administrator. I reached out. I said, can we talk to town council and see if we can get some kind of processes in place to, have fines. People are not responding to us, and we're getting increasing complaints. And I don't know if you want to talk a little bit about this, Carolyn, because you've seen it, but it's been very, very disheartening that people are not responding.
Yeah, I would say about 50 to 60% of the phone calls we get into the office every week are just of complaints in the neighborhood, like environmental complaints,
Right.
rodents in the area. There's another neighbor, like illegal dumping. We were working with DPW for a little bit about that. Just random trash going around, like unkept houses, like with brush and everything, because people are concerned about rodents and they're concerned about ticks. So we're like constantly, now that we have Jenna, our new health agent, it's been a lot more helpful that she's here, because she does go check on those complaints. Now that she's in her position, but before it was like every other day we would be going out to another house, take pictures, sending a letter. And it's also a waste of postage for the town too, because we're constantly sending these letters and no one's responding to us. No one takes us seriously. They get the letter and they're like, okay, whatever. But I think with these fines, it'll be really helpful because it gives them a direct timeline for compliance, and then it'll say like exactly what's going to happen if they don't follow that timeline.
Or do you have any questions?
No, I think it's great, Caroline, and I think that it helps that the CMR, the law is written there, so it supports what you're doing. And I think the increments are good. The increments of the first, second, a third notice goes out. So how many notices? 3. So yeah.
3, and then we bring them to court. Is that how it would go? Yeah. Okay. Anyone have any more questions on that?
Yeah, I do. Carolyn, right? Carolyn. Thank you for doing the work you do. I imagine it's stressful being on the receiving end of these phone calls of people who are upset. So I really appreciate everything that you do to help manage that. I bet it's not easy. So I have the letter looks great. I'm in support of the fines. I have a couple of questions and a couple of suggestions. So do you send a letter out because there's no staff capacity to physically knock on someone's door, or it's a safety issue of the employee that you don't want to go out? Like what's behind only mailing the letter as opposed to knocking?
Yeah, I think from when I started, the protocol was always to send a letter. I remember my first year working here, we went out for a trash complaint, and I was like with Emily, the previous assistant health director. It was a trash complaint in a neighborhood, and we saw a resident coming out of the house we were looking at. And I was like, oh, like he's right there. Why don't we just go and talk to him? Did not turn out well. He was like cussing us out, swearing, throwing F-bombs. I think it's like a employee safety thing that we don't knock on the door. And the pictures we take, unless the person calling lets us onto their property, we're only taking it from the public, like plain view public streets. So that's another thing.
And what happens if you can't get into the private property part to look?
Usually we'll be able to see it if the complaint's that bad for them to call from the public view. But the other half of the time, people will let us onto their property to take pictures. I don't think there's been an incident where we struggle to get pictures. Yeah. Caroline, I don't know if you have anything else to add.
Yeah, I
I feel
agree.
like
It is a safety issue because you're kind of taking them, it can be a lot of time an anonymous caller or neighbor. And when you see them, outside their house or you're knocking on the door, you're kind of confronting them. And we don't want to be confrontational. We want to send a letter. We want to talk to them, but we want to give them, the consideration of a letter to say, like, call the health department. This, the pictures will tell the story, and let's see how we can figure it out.
Got it. That makes sense. That must be really stressful also to go out there with hostile owners. So thank you for doing that as well. Okay. So, so I have, so at the bottom of so I was very, moved by what happened at our last Board of Health meeting with the condemnation experience. And I also want to talk about making sure we do executive session next time, but that's a separate agenda item. So I was very moved by their situation, the condemnation. It's obviously my first one, and the tenants, the owners came, not the tenants, the owners came. And so everyone knows I actually want to learn more about the process of condemnation because I was very moved by it. And so I actually asked Ann Grossman, the health department social worker, to set up a meeting just to pick her brains about when people call, what services do you offer? It's just as a learning experience. So Caroline Kinsella and Ann and I are going to meet just so I can learn more about it. But the point is, what I was wondering in that situation was, electrical, for example, in that example, in my own home, electrical can run tens of thousands of dollars to do upgrades, right? And there were a lot of issues in other situations. So when we give fines, I'm wondering if there are any accommodations for income disparities, or like on the back page of what you sent me in the packet, it has a list of permitted dumpsters in the town of Milton. And there's a note that says you would only keep that in the letter if the violations are related to trash or bulk items, of course, which makes sense. And so there's a list. So a couple of things come to mind. If you're asking low income folks to clean up their property, they might need help renting a dumpster, or they might need to hire, maybe they're elderly, or maybe they're disabled, or maybe they physically can't do it themselves, and maybe their adult children have moved away. Or so again, it goes back to that. And I know Ann, I looked at her list of the Ann Grossman, the social worker, her list of duties, and I'm blown away by how much she does. It's really incredible and really speaks to talking about maybe even having more staff for social work, because that really blew me away. And so the question is, what if somebody does want to rent a dumpster, but they can't afford it? What if somebody does want to clean their yard, but they're limited in their capacity? And so I'm wondering, is there a financial help, or even the social worker could help to do case management? Maybe the folks are, if it was my elderly mom, she wouldn't be able to even know where to start. So just wondering about if we've considered maybe the residence fund can help fund this, what sources of funding might be available for income eligible property owners. So I realize it tends to be what's the word? An oppositional situation because the town is fining somebody, but there's also an equity issue where it just might be that the people don't have the money or don't have the capacity. So I'm just wondering if we could add if there is something that you might consider in terms of process and protocol, and B, if so, if there's a line maybe we can add to the letter that says if you're having difficulty executing this, or if you need guidance or help or advice with the town social worker or the residence fund or whatever it is. So I just want to pause on that and see what you thought.
I just have a question too. My understanding of what first notice of code violations is if they contact the health department. There won't be
So
an
we're
assessment,
gonna, so
right?
the
There
idea
won't be a
is so
fine
there won't be a fine unless the time of compliance has already passed, and it's
without
usually
them
gonna be
contacting you. But if
without
they've
them
contacted you
contacting
and
or doing
working,
anything.
so if they're
Yeah.
already working with the Board of Health, there would be no
Fine.
fine.
Yeah, we for our housing cases, we usually do like a good faith effort. That's what we go based off of with
Mhm.
like taking it further to court or fines. So I think the first notice is going to be sent out to people just to, like get their attention that there's a problem.
Mhm.
And they'll have the time frame of compliance, which is usually like 30 days. So they won't get fined unless a whole 30 days goes by and we have no response from them and there's no action, if that makes
Mhm.
sense.
Okay, that's what I thought. Okay.
Yeah. Going back to Deborah's point, I agree with the residence fund on our housing cases and correction orders. We do have that section on another form to contact the residence fund. That is a little difficult, and we can add that to this letter, but it is difficult because most of the housing cases we've dealt with in the past, when we've reached out to the residence fund to see if this is something they could pay for, if the homeowner is like struggling to financially pay for it, the answer is usually no. So that's kind of tricky, but we can add that into the letter as well.
So wait, if they're struggling to pay for it, they say no, they can't
Yeah,
help
like
them?
a service. Like we've had like I would count like maybe 3 housing cases now where we've reached out to the residents fund to see if they can help this person, and the answer has always been no. So I don't know, like I feel like the qualifications of who they can help, like it's they're kind of
Yeah.
strict, so
Well,
I'm not sure. Like the
now,
limitations of it.
uh-huh. Okay, so going to Caroline, what, remember when they say the Brook Road one with the old man and you guys were there and getting dumpster,
Right.
how, who helped pay
So-
for that?
So we appointed a receiver back then, and the receiver paid for the dumpsters. And there was about 12 dumpsters that went to that house, and they did all the work and brought it up to code. The receiver did. And so that's how that could happen. That house was condemned.
And then the receiver gets to sell the house and take whatever he spent.
Yep, kind of like lien the house to
Mhm.
get the proceeds of bringing it up to code. Yes.
Okay. Okay.
But have I called Noreen Dolan in the past to ask her for, like, she will evaluate, or Ann will evaluate. Ann will talk to them to see if they're low income or whatnot, if they're struggling, and then she can reach out to Noreen Dolan, and she would do that kind of internally and see if could we work with them. Maybe they don't have enough money for a trash sticker. We've done this before. Or we've paid for the trash barrel for a year, things like that. We have done that with Noreen Dolan before. So, I mean, it's on a case by case basis. So we do that. If someone says to us and expresses that they're not able to pay something, the $100 fine, then we'll work with them.
I think that's also important why we have that statement of like, please contact our health department just so we
Right.
can talk about it more and then assess like what's going on here.
Right.
Where does it say?
On the first notice of,
Where does it say that?
no, wait. The first assessment of fines, but it doesn't say it of the first notice of the sanitary, does it?
First assessment of fine at the bottom, it says, please contact the health department.
10 days.
Right, but shouldn't it say it on the first notice of sanitary code violations in order to correct?
We can
Because-
change it and add it, yeah, to make it more
Yeah.
prominent. Please contact us.
Yeah, because it doesn't say it at all on the first notice. It does on the first assessment of fine,
Hmm.
but not on the first notice, and it should be on there.
Yeah, we can add that.
Well, it does
Oh, wait,
say
it does.
It says if you have any questions, but to call. But I think what I'm really talking about is tone and really making it clear. If you need help, if you need to talk to somebody about this, there's a social worker on staff. If you need help paying for some of this, like I realize adversarial, that's the word I was trying to think of earlier.
Yeah.
I realize that these do feel adversarial because you're issuing a warning, right, of a potential fine. But they're also our neighbors, and they're folks who might have issues going on mental health. It could be any number of things. And so I'm wondering if we could just add in a line where if people, not just if you have questions, call us, but we have a social worker on staff. If you need help, if you need help, I mean, you could.
Figuring out. I wouldn't say help paying, because then there's the expectation. And if they
Yeah,
get
yeah,
denied,
yeah.
so just say if you need help in this situation, whatever, getting out, some great way to phrase it, but just if you need help,
Yeah, yeah.
contact the Board of Health. That I think would be a good
Oh,
idea.
not the Board of Health, the
No.
social worker
Oh,
or the
yes.
health
Yeah,
department?
well, Board of Health social
the health
worker.
office.
Yeah.
So
Because
not
they'd
the-
have to be working with everyone, really, not just the social worker. But
Right. But
also,
what I'm saying, so then we should have two different. So one has to do with questions around the ordinance itself, but I'm talking about if people need case management to help them pull this off. They
Right.
might have mental health issues or disability
Yes.
or income.
right, yeah,
And
you
so
could
that's-
say, the social worker, her name and her phone number at the Board of Health.
Although I don't want to insert that without consulting Caroline and Anne, because I notice Anne's list of duties is a mile long and I'm blown away by it.
Well, that's true too.
So I will defer to Caroline to add a line that you feel is appropriate, and maybe it should be referring to Noreen Dolan directly. I don't know, but you guys can figure that out. But I think that's a separate,
It could
question.
say, it could say instead of questions, it could say, if you would like to pursue assistance with this matter, please call. And then, assistance means, all disciplines, whoever's available. However, Caroline, you've handled these sensitive issues for so long and you've accomplished so much with them. Assistance might be a better word than if you have any questions. It might.
Yeah, assistance is
a word.
available or something.
Assistance is an in-kind word that says, okay, I think maybe they can help me with this.
Great.
Yeah.
I like that, Maria. That's great. I like that word.
So maybe just like assistance.
Oh, Mary, you're muted.
I'm sorry. Once they make that call, they're going to realize there's a lot of forgiveness within the health department, because that's kind of what everybody does in the health department. They're trying to work with people and find the middle of the road. They'll understand that once, when they make a call, they'll get that their life is on the line, that you guys work, we all work with people.
Right.
So
I think
assistance is better than if you have any question. If you would like assistance with this matter, please talk.
Yeah, and I think put it as a separate paragraph, because you might stop reading when it's just at the end of you're currently in violation of blah, 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 blah. They may stop.
You could,
So if
you
it's
could
a separate paragraph as to if you need help.
You could put the state law like at the end. You could put a little asterisk and just so they'll gently, kind of refer to like the law that supports the pursuit of the health department. So maybe just the order of kind of operations here, if you will. Maybe just the violation in the sanitary code, the law. It can just kind of go down the bottom, just as a reference for whoever's reading it.
Can I ask a question? Are there any social service agencies regionally or in the state that do help people with these kinds of things? And maybe we could also put in the phone number of a regional or state social service agency. If they do that, it would require some digging. it would just be nice to offer people in this letter additional options for help in addition to the health department, given how limited the capacity is for Anne or Noreen, for example, the two social workers.
Mhm.
Just a thought. You don't have to answer now, but if you maybe can do some research, and do you guys know of like
The social workers might know
Yes.
whether
No
they
more.
have anything.
yeah, that's a good idea. Okay. Okay, Caroline, maybe we could ask Anne, or you could
We could talk about it on Wednesday.
yeah,
Yeah, I'll see you tomorrow.
that's
Come up
great.
with the language. Mhm.
And
That's
you know,
great.
when
Okay,
the
thank
order,
you so much.
the order comes in this, you know, for correction, but it gets lifted too once things start to, you know, roll out the right way. So
Yeah.
that's it's not a permanent thing, and they'll come to realize that. I mean, it'll get lifted once the problem is remedied to a certain degree, right, Caroline? That's kind of usually what happens. So
Yeah.
usually in the past, we've tried not to get the fines up really high. Like we've given people time. We've given extra time in the past and worked with people. So
Well, if they're working on it, they wouldn't be fined.
right.
If they just totally ignore
Yep.
the letter.
Yep.
I think my concern is that when people ignore a letter, it means there's something going on. It's not malicious, right?
Oh,
It's
no, I understand that. Yes.
yeah. So just, yeah. And then unrelated to this particular question about these two letters, and I really appreciate that you need some teeth to it. That makes sense. Separately, I would like to find out from the residents fund, and maybe I'll reach out to Noreen, or maybe I don't, what the standard policies are for assistance in these cases. What are they basing the 3 denials on? I mean, did they request? I mean, they must be basing it on something. So that's something I want to circle back to and find out about, because the residents fund is for residents who are in tough spots. And even though I realize it's an adversarial situation, there might be a reason. Usually when people's properties, when they're nuisance stuff, it's because, as you know, there's other issues going on.
Right.
It's not just non-compliant. So, okay. Thank you very much.
Okay.
Okay, would you vote to approve with the
Uh,
changes, with the edits that we're talking about?
I vote to approve with the edits to add about the Board of Health available for assistance.
Yes.
Would it be okay? I'd like to kind of see it edited. I'm happy to approve it now, but would it be possible to get the final version?
Yeah, why don't we hold off the vote till September, and we'll have hopefully a chance to get the letter right, and then we can vote on it then.
Do we
that's
not
fine.
do we not meet monthly? Do we not meet in August?
We don't usually meet in August.
Oh,
Vacation.
we can put that off.
Carolyn Ho, is there a reason? Is there something pressing for you that would be problematic to wait till September?
I don't think so. I think we've just been sending people normal letters without the fines for now, so we can just continue doing that until we vote on it September. So that should be fine.
Okay.
Okay, so we'll wait till September on the vote.
That's fine. Okay.
Thank you. So so that's great. So I'm going to I'll reach out to Noreen around what the policy is around denial, and that I'm very curious, and I'll bring that back to the board for the
And
new
what
year.
kind of things do they cover? If they don't cover a dumpster, like what do they cover? Is it like a mortgage payment normally or something like that?
That's a great question, Laura.
I think most of the denials, at least one of them I know, I think it was like income based, like the person we were trying to help made too much money on paper.
Oh,
But
yeah.
it's like difficult because all of their money was like going to something else that obviously couldn't afford to pay the pressing
Mhm.
issue that was in the house.
Right.
So it's just difficult.
Mm-hmm.
Great.
Okay,
Thank you.
all right. So we'll table that till September. And moving on to number 8, opioid abatement funds discussion. You wanted to discuss, Deborah, you'd mentioned about the scholarships. We have advertised for the grant scholarship opportunities for summer camp, grief camps, arts and healing, yoga, cooking classes, and grief support groups, up to $2,500 per individual. And we ask people to follow this request up with a small 2 or 3 paragraphs of how this would, a testimonial, how this would impact them if we could fund it. We have advertised this in the paper. It's on our website. Anne is the contact, and she hasn't received no one's contacted her yet regarding this small grant scholarship request.
Okay.
Okay, so this is on the agenda because of my request.
Yeah, you requested
Awesome.
it, and I
Thank
talked to Laura, and she said, yeah. And I think we should kind of keep on putting it on there just to discuss it. You know, if there's anything else that's happening with the opioid abatement funds, you know,
Mhm.
moving this forward, and you know, working with and behind the scenes, I'm working with Norfolk County 8, our collective health departments. One of the reasons we're working with them is they like you to do that. They like you to collaborate with the other health departments, even with like the recovery coach that we have, to do the collaboration around that. And, you know, I know I told the board that I had multiple meetings with a number of mental health care providers to see if we could bring some services to town residents and the schools. And when I went in to talk with technical assistance RISE about this, they denied it and said we could just call the mental health hotline. And that we brought that up in our Norfolk County 8 meetings to say, like, you know, there's so many restrictions around how to spend this opioid money. You know, they knew I was going to Care Solace, Lumen Interface, you know, meeting with them one-on-one. Ann and I were meeting with them, getting pricing. We got all the proposals, and still they didn't say anything until they said, well, you can't do that. And so we were very disappointed about that. They said that, you know, collectively as a Norfolk County coordination, they may be able to interface better with the technical assistance group and may be able to we can put forward some services that we want to, because I brought it up in the meeting that there are other towns that are using this. They're using these services. The opioid money is paying for it. And what happens to those towns? I don't understand. There's no repercussions. So they're using it. And then we have to give yearly reports on this money, where we're spending the money, and they're not being told that they can't do it anymore. So there's my frustration. You know, if other towns are able to do this, and then you say, oh, Milton can't do it. Well, there's no consistency, and there's no repercussions for people that other towns that are doing it already. They're already doing it. So it's very frustrating.
Is it possible that the towns that are doing it aren't able to use the helpline, or is everyone in every town able to use the helpline?
Every town. That was the the feedback that we got from Mosaic.
So, okay, so everything,
So like
okay.
everyone can call the Massachusetts Behavioral Health Line. Everyone can do it. You can just call them and get the help. So why do you need Care Solace, Bloom, and Interface? That was the,
Mhm.
and they're more comprehensive. We had a long discussion about that, and it's still they were giving us pushback whether we get Norfolk County 8 can hire some kind of, and they're talking about this intermediator to be able to go and research and find out why we can't have it. Because I expressed my frustration.
Mhm.
Why can't we? I know other towns are doing this. Why can't we offer it to our residents? And it's very, very disheartening that we can't. So they might be able to, it's hiring someone from BME Strategies, which is, oversees the public health excellence grants that are coming down, to have somebody maybe just part-time work on behalf of Norfolk County 8 to see if we can push things through. Can they meet again with Rise and Mosaic? Can they be the person that says, we should be offering this and give the reasons like we already did? They said no. So they're working on that right now.
Okay.
I wonder how long it'll take to get some answers on that. Did they give you any kind of timeline, Caroline? It's like,
I think in the next month or two, they'll have a proposal that I'll bring to the board.
okay.
Yes. I'm hoping that they will, because we did talk about it. Because it's not just us that need, that are putting forth proposals that are getting denied. You can hear the frustration with the other towns too, saying like, everything has to be approved. I get it. And we're submitting yearly reports, but there's a problem with the guidance and, on par with other towns, like what's going on. So I'll bring it to you, the proposal, when we get it.
I'm sorry this has been so frustrating. Can you clarify when you said they are working on it to find out who's they?
It's BME Strategies, and they're like they consult for the Public Health Excellence Grant. So we have the grant, and it funds the regional public health nurse and the regional epidemiologist. And they're looking also to put some kind of a part-time position in addition to those two to help us with the opioid abatement monies. So they could kind of interface with the technical, you know about technical assistance, Deborah. The technical assistance.
That was one of my jobs for 4.5 years. Yes.
They're interfacing with the technical assistance group to say, like, how can we bring this to Milton? How can we bring it to Dedham, Norwood? And we're working collectively as a group, bringing it forward.
So this is through Norfolk County 8. You're talking about the collaborative with them to try and sort this out. That when you say they, you really mean the NCA?
Yeah, I do mean NCA.
Okay, got it. Thank you. I appreciate that.
Yeah.
Okay, so, and then the mental health, were you saying that you had, and this is just a side question, I have more primary ones. Are you saying that the mental health hotline, you had wanted to hire a vendor to do that, and they're saying you have to use the state's vendor, or you were suggesting to hire a different kind of vendor, not a hotline? What was the service you were looking for specifically that they declined and said you have to use the state hotline? Was it also a hotline?
So it is like a hotline, but I could send you, there's 3 contracts and 3 proposals that were sent to us and what they'd be doing in this referral process. So, and what they would be able to provide. So we've got 3 proposals, and I sent them to Mosaic, Arise, to say, what can they do for us? How can they help the town and help the schools? Because the schools have, mental health referrals that they need. So they just pushed back and said, oh no, you can call the behavioral health line.
And
So
what is the
service? What's the I'm sorry, you had 3 bills for a particular 3 bids for a particular service. What's the specific service? I'm still trying to understand. So the service is,
if you call and say you're having a problem with bullying, they would hook you up to like a provider that would specialize in that. Or maybe you're having a problem with, I don't know, anorexia. They would find a provider. They would look in their network and find a provider that could help you.
So it's a referral. It's a referral network.
Yes.
And the
Yes.
state is saying that their hotline has a referral network.
Yes.
Okay. So why, I realize it's incredibly frustrating and disappointing and annoying, but so why wouldn't we just use the state's referral network?
That's what they said. But I think that this is a more comprehensive. They work with the schools, they work with the residents, they're providing more services than just a phone call. Yes.
Great. Okay. Sorry. Mary, were you going to say something?
Thinking each one is different in what is different about each one. That's kind of a point of clarification, I guess. What appeals for this? What group does this that this other one doesn't do? Kind of maybe somewhat descriptives about each one of them.
I'm happy to send these contracts and proposals to you again. I know we discussed it many months ago.
Yeah.
Because Ann and I met with all of them virtually.
Mm-hmm.
So you can see too what they're offering. Ann and I thought Cure Solace was the best at that time. We were going to move ahead with Cure Solace, but then they said we couldn't.
So really my interest is not necessarily, I'm curious to see what exactly, what services do they see are duplicative and what are not. That's really kind of where I'd be interested. But I think it raises a bigger question, and really what we've started out with is talking about these small grant scholarship requests. And so to kind of finish out the mental health point that you brought up in terms of wanting to provide supplemental mental health services, at the state is saying, no, we have that. And you're saying, no, it's not duplicative. That's very interesting to me. So I definitely want to learn more about that. Maybe, well, anyway, and I'm glad Norfolk County A is looking into it. So I'd be very interested to hear what they come up with. So thank you for that. But getting back to the small grant opportunities, how many people to date has applied for the small grant scholarship request for 2026? I think I heard you said none, but is that what you said?
Zero. None.
Okay. So, and I heard all of the ways that you tried to advertise it. And I'm wondering if you were able to loop in the Family Restored or the Sun Will Rise, because they know all of the Milton families. They work with the Milton families intimately. I'm wondering if you were able to partner with them to help get the word out for the scholarships. Like
I believe they know about it. I did talk to the Sun Will Rise, so they're aware of it. And I'm sure that they spoke to the Family Restored too, to say, like, this is available if anybody wants to, apply for it.
I'm wondering if it's not meeting the exact need, like the scratch isn't meeting the itch, so to speak. I'm wondering if maybe there needs to be for next year's round of grants. And actually that is my other question is this open year round? And is it, I see camps is just one thing, but I see there's also therapeutic activities, arts, healing modalities, yoga, cooking classes, and then there's also grief support groups. So this, to me, I'm assuming is a year-round thing that's open year-round and not just for camps.
It's open year-round.
Yeah.
2026.
So I'm thinking that maybe the way this is being presented or circulated, that the families themselves, for some reason, either that maybe we need to revisit what the families really need or want. And I'm almost thinking to revisit the planning around this with the scholarships, since no one applied and we have a lot of substance use disorder in Milton, and the sun will rise, and the family restored works with a lot of families, and that maybe we kind of invite some folks to the table to kind of revisit this whole opportunity. And I know it came out that this was a request, that people asked for this during the assessment, when we were doing the opioid assessment. There's something about this that isn't meeting the need, and I'm wondering if maybe we can go back, we meaning, I don't know who, maybe pull together a task force in town, right, of folks maybe who participated in some of those original focus groups, and to find out, maybe pull in and have a working meeting with the Sun Will Rise and the Family Restored, rather than kind of just circulating by email. Maybe have a meeting and asking them, do you think this is meeting the need or not, and just sort of revisit it. The other question I had on the form itself, which is more an editing question, it says under grants and scholarships, you list camps, the therapeutic activities, and the grief support groups. And it says for grief support groups, funding is available for up to $2,500 per individual. And I was wondering if grief support groups cost money, like maybe they don't cost money. And maybe that's why people aren't requesting the money.
We could put individual therapy, you mean? Or let's see. What does it say? Grief support groups. Could use some other words in there to kind of maybe, if somebody needs something individualized rather than,
They could bring it to us.
another selling point.
Yeah. And then the other thing is on the back page, on the second page, it says organizational information, which was very confusing to me as a reader. And then I see at the bottom, you say, please note, if an applicant is selected, payment will be issued directly to the organization providing the services, camp or grief support group. The organization must submit an invoice that includes the participant's name along with a completed form, blah, blah, blah. And so the funding isn't going to the individual, it's going basically to the vendor, the organization. So firstly, that was confusing. So maybe put the note at the top. But secondly, I'm also wondering, maybe that's part of the issue, is like, where in the pipeline is this opportunity getting stuck for people? So I think I would recommend maybe pulling in folks. I know Robin from the Sun Will Rise, and I know the Family Restorer would be very probably interested in helping to circulate this, get this off the ground, and maybe even like tweak it so it really does meet the needs. Because it's interesting that nobody applied. There must be some disconnect that we're not realizing.
Mm-hmm.
I could talk to Robin. We're working with her for the International Overdose Awareness Day anyway.
Oh, great.
And she does know about these grants because I talked to her about them. But if there's something she wants to add to it or tweak, happy to reach out and ask her if she has any recommendations around the language that is in it.
Yeah, maybe ask her why she thinks nobody's applied.
Yep.
Yeah. Great. Thank you.
Sure. Okay.
Yeah.
Want me to move on to Health Director's report?
Mm-hmm.
Okay. So there are a couple of things in here, just a couple of just updates. 68 Smith Road. I did speak to Michael White. He's the building commissioner. And he said that he wanted to have a structural engineer assess the integrity of the building. And we've been talking about this for a long time at 68 Smith Road. 68 Smith Road is condemned by us. And just this week, the church leader who I've been working with also, Mr. Evan Durandis, or Evan Durandis, excuse me, said he was going to be thinking about selling the property. So he said he was a realtor and he's thinking about selling the property. Whether they thought maybe it cost too much money to get a structural engineer in there, he didn't really say. But that's what he told me this week. So, and then, any questions about that? Moving on. So he connects with me every month and tells me what's going on. So that's the latest to what he said. Then 59 Thatcher Street. I sent an email to the representative, the lawyer, Richard Joyce. Actually, he hasn't responded. And the last time he did respond, he said that he's been working with the planning board. I know he's working with the planning board because I talked to Liz Manning today about that. And she says that she's hoping that they submit another plan. So I'm not sure the first plan they submitted, if there was too many units, but I was also happy to hear that Marion McGettrick is involved. So we've worked with Marion McGettrick in the past. I didn't know she was involved with 59 Thatcher, and that, they're working on that, submitting some new plans. So that is very good to hear, because we did have another complaint regarding that address. I don't know if, we'll have to see in the coming month if they do submit something going forward about how many, what their plans are and how many units they're going to have in that property. But I would maybe, if September comes around and this is like a month from now, nothing's happening again, the board might want to consider condemning this property. We talked about condemning this property. We never condemned the property, but that kind of sets the timeline in motion to condemn the property because they have a year to do something. And we've been sitting on this for quite a while, and they've been saying that, it's taking time, and I get it. It takes time to get things done or submit plans, but the neighbors have, told us it's an eyesore, and maybe we should consider condemning it maybe in September. If nothing has come forward, we have to have more of a plan of what's going on here. I know they're working with the planning board, and I know we've been patient, but that's just a consideration. Just it's something to think about going forward with this property.
Can I ask a question? Is 5 to 9 Thatcher? I know it's the old InSync building behind the Milton Food Mart, but the 5 to 9 implies there's more than one property. Is it just the one building? I know there's also an abandoned house next door. Are you also talking about the house, or is that a separate totally?
We're talking about the house too. Yeah, both of them.
So the whole property is owned by the same owners? The both houses, the big building and the house is owned by the same owners?
Yes, there's two. There used to be 3, and they bought out, I guess, 1, and now there's 2. So,
okay.
If nothing happens in the next month, maybe a consideration.
Thanks for the update.
And then 333 Thatcher Street, working with them, Carolyn and I went out. They're actively fixing the violations. The final inspection will be soon because Carolyn did reach out. So we're going to go out and make that final inspection and close this case. And then 4 Craig Street, I spoke to the building commissioner, Michael White. He said that the utilities and the water has been shut off to the house. There's been no activity. And he said that no one has contacted him regarding permits. No one has contacted the health department either. So nothing has been happening at that house.
So what would our next step be on that house?
So we're going to have to see what they're submitting, what kind of permits. Are they going to be doing some work inside to fix all the violations that we saw? They were moving ahead. They had a dumpster there when we were there. And so they were cleaning out the property. So they have to bring it back up to code. I don't know, the building, it really would fall to the building commissioner to say, like, you created all these bedrooms in the basement, is there egresses? how
Right.
many, what can be actually created there. There's bedrooms upstairs in the first floor, but you're creating like 6 bedrooms in the basement, 2 more in the attic that we didn't know about. And they said they didn't have anything in the attic, but the building inspector did find that there was 2 more bedrooms in the attic, and it was closed off by a refrigerator. Something was closing off that. So basically it was like a rooming house. They had
Mhm.
multiple people there.
Don't we have
Terrible
a,
conditions.
don't we have a law that only a certain amount of unrelated people,
Yes, 3. Yes,
3,
yes.
and so who enforces that law? Who knows?
That's really up to town council and the building inspector,
Hmm. Yeah.
So,
Okay.
so right now we're just waiting to see what comes about. I'll connect with Michael White again to see if he's heard anything, or what their plans are, but they have not reached out. And then just some other updates about the food bags. We have the take one, leave one shelves are continually being restocked. Anne's ordering through Amazon. We opened the food establishment Julienne's down above the food center. That looks nice. Wednesday, we're going to be going out to 2 Pence. It's constructed, plan review, and just going to see if the refrigeration was holding them back. So they finally have the refrigeration, and they're scheduling an appointment for us to go out and do an inspection before they open up. So the hold up with them was the refrigeration. Dana Conroy went out to look at the farmers markets, so that continues every week. And Anne actually did some tabling there regarding our food bags and just being there with the table, and the resources that she can give out as a social worker. She just went out last Thursday, around that. Susan Poirier is working diligently on the camps, 20 camps this year. It's been very difficult for Sue. This is the first year I've heard Sue say how hard it has been with the camps, because there's so many camps and there's so much paperwork, and it's been pretty overwhelming for Sue.
Were they any better getting the paperwork on time, or is it still
A little bit better?
Mm-hmm.
Not as bad as last year, but still, it really always is. Like you're pulling a tooth.
Yeah.
Some camps are better than others. You know which camps they are. They'll provide the information, but it really is the back and forth emails. You're missing this. You're missing this.
Mm-hmm.
Someone has to get a vaccine. I don't see this. So it's been a lot of back and forth with emails. So, yeah, she's been very busy.
Yeah.
So the approvals are still going on, even though it's July 20th?
Oh, yeah. Yeah, I think she's gotten through about 3/4 of the camps, but there's still camps that are opening in August. They're not all open yet.
Oh,
They're often 1-week camps, like
Yes.
soccer or
Yeah.
whatever.
Yeah. Mostly at Plum Academy and Curry College. It's where they're running out of.
Caroline, do you think that the health department needs more capacity for this moving forward?
Well, it's been very difficult on Sue. She's 16 hours a week during times when there's this increased capacity. She can raise her hours up to 19. And so she does. Because I say, Sue, you're working so hard, but she's working full blast just on the camps. That's really her only mission, is to put all her time towards the camps. She does do, especially in the summertime, she still does her blood pressure clinic at the Council on Aging. She'll follow communicable diseases. She does other things, but really her main focus is camps.
Is 19 hours a week enough to do all the camps and blood pressure clinic and all of that stuff?
I think that, she could always use more hours, but, the town wants to keep it under the 20 hours.
So I'm very happy to revisit this. This seems sort of putting the burden on the staff person. instead of expanding capacity for the department, because it's only going to get more and more every year. This year, right? Like last year it was less camps. This year it's 20. Next year it'll be more, right? Yeah, we should talk about this. Maybe yeah.
Then the next is, I told you about the regional public health nurse, Allison Brum. She was hired in Dedham. She can come on Thursdays to our office, and then she'll be moving around the different health departments. I sent the job description for the per diem maternal and child health nurse 3 to 4 hours a week to HR. So I'm waiting for some feedback from Carla about that. We do have it in our budget. And Susan will be helping me too to kind of acclimate this nurse when she comes on too. And then I had a planning board meeting with the director, Liz Manning. So.
Oh, sorry, you're going on to the next thing. I'm sorry. I wanted to just say one thing about that. Congratulations again on the 3 to 4 hours per diem for maternal and child health. That is so exciting. Which we're sort of all acknowledging that's basically one visit per week, one postpartum or whatever, or prenatal visit per week. So it's acknowledging that at this point it's just going to be one visit per week, and we're starting slow, and it's like a pilot.
Yeah, so we haven't even sussed that out yet. What it's going to look like. So we're hoping that Allison can do that. Yes, and then when this person comes on, they can kind of follow her lead and get some procedures in place about what it's going to look like. I think every town will be different. Other towns have full-time nurses. They have multiple nurses, and we have our nurse Sue and this 4-hour nurse. So as I said, it's going to look different in other towns because there's more capacity in other towns. So we'll just start slow and steady with this program.
Awesome. Well, congrats again. Okay. You can move on.
So I had my first meeting July 9th with the the planning board director, Liz Manning, regarding short-term rentals. I hadn't heard about this until, you mentioned it too, Deborah, that they were working on some language, and still working on the language and working with town council regarding this. When I was asked to come to this meeting, Michael White was unable to be there at the meeting, and he would have been really important to be there at the meeting, because we have to figure out who's going to be doing this work, and we don't know that yet. So I did speak to the town administrator, Nick Milano, and he said that we have to have a meeting with Liz, the building commissioner, and myself to kind of suss out again who's going to be permitting, how is this going to happen, and who's responsible for what. So there's a lot of moving parts. I mean, I've seen a couple of the the
planning board meeting
plans and stuff, the planning board plans and stuff regarding this. I have some questions about it, and probably has to do again with what are the procedures, like who's going to be looking at this. I brought it to my staff too. Carolyn knows this, is that the inspectional services are always sending down requests to us for us to process. And so it's not like we're not going to be involved, because we will be, whether this is someone on septic that wants to have the short-term rental, we've got to know, how many bedrooms. We've got to know if the septic system can be able to support whatever they're asking for. Who's going to be the main point person to be doing something like this. But we're always getting emails. You can say that, Carolyn, and chime in from the building department to be, especially with the demolition permits and stuff, we're always being pulled in. And questions around, people are coming and going in and out of these short-term rentals. If there's problems with trash or rodents, they'll be calling the health department for us to do inspections. So it's not like we're not going to be involved, because we're already involved. And so a lot of questions. And I spoke to Liz again today, and Liz said to me when I met with her initially, she said that that there was going to be like you said, a task force or a working group to kind of, go through the regulations and ask questions and maybe even bring it to the public, instead of sending off to town meeting and not really having a clear picture. We don't have a clear picture of, who's going to be overseeing this and what's the process. It's not just even the building or the health department, it's the police and the fire department. So who's going to be enforcing all this? Who's going to be the lead?
Yeah, cost projections.
Right, exactly. I mean, are you looking for, to make money with excise tax or whatnot? And, can that support some more staffing? Maybe it's not in the health department, maybe upstairs in the building, and they can do some code enforcement up there. But again, we don't know the numbers. One number was thrown around 75. Is it really 75 B&Bs that are registered? But is there 100 behind them that are not registered and that will register when they find out, this is a process and this is what you need to do? So it's all kind of like wide open. There's a lot of questions, a lot of unanswered questions regarding this. So still going to have, hopefully this week, we'll meet with, as the town administrator says, we'll meet and we'll get a little bit more clarity around this because we don't have the clarity. And Liz agreed with that too.
Caroline, and then what do they want to bring it to town meeting, right? They want all this to go to town. Do you think all the information will be together by the time this town meeting? It doesn't sound like it.
No, Nick didn't think so either because, I don't know how much time they put into it, but we just had our first meeting. I just had the first meeting with her like 10 days ago, and Michael White has not met with her. So this is going to be impacting the building inspectional services also. Not just, as I said, not just the building or health, it's the police and the fire, because they're going to have to do some inspections too. So, I mean, that's going to impact inspectional services. They should know what they're going to be responsible for. Yeah, because we'll all have to be signing off on things. And just as we do with demolitions, we all have to sign off on things. So, and then, how often are they going to be inspected? What kind of fines if they're not doing what they're supposed to be doing? How long are these short-term rentals for? Is this going to impact the schools? If you can turn around after 120 days and say, do another 120 days at the same short-term rental? I don't know. But a lot of questions. And I don't know what the answers are.
So I watched the recording of the 2 planning board meetings where they talked in great detail about the article. And one of the things that they said, which I told Caroline, this is for not more than 30-day rental at the max, because there's a state law around maxing it out. Can't be more than 31 days. And I think right now this article says no more than 30 days or no more than a month. But let me just back up a little bit. So I support having regulation of short-term rentals. I think it's kind of urgent to get regulation because right now it's the Wild West. There's no language. So if there are, I won't say infractions, because if you have no regulatory guidance, then there's right. It's harder to monitor infraction. So I know that from a health and sanitation standpoint, it would behoove us to get something in place and to regulate these short-term rentals. I heard the number that there was 40. Somebody looked online, Airbnb or whatever, and that there was about 40. And as Caroline said, there's probably, dozens more we don't know about. So in terms of timing, I think that for health and safety, it gives the health department and it gives the town power and authority to actually crack down on if there's any sanitation or health and safety and problems. So I think regulation actually behooves the town and to get it in as quickly as possible. The other thing is I think the health department, I think, Caroline, you're in a really good position right now to inform their language because they're working on the language right now. And they're open they're open to recommendations and suggestions, meaning the planning board right now. And if you watch the recordings, they've been very thoughtful and very careful and very detailed about all of the concerns that have been brought up. They did mention having a community forum to get additional feedback. So I really appreciate and I like the fact that you're meeting with the housing inspector and with Liz. So the three of you can maybe come up with, or you can come up with recommendations such as, well, we think housing inspection, housing should do the standard basic annual inspection. And if there's code violations, then come to the Board of Health. Rather than saying the Board of Health is going to have to do every annual inspection. Right now, it's an annual inspection. And again, this is a really good opportunity to provide your recommendations, not just sit back and just hear what is being expected, but to really say, listen, this is what we can handle. This is our capacity. And my next question is, what is your capacity it sounds to me like Carolyn Ho and you all are doing an unbelievable job with already doing tons of inspections on a lot of other stuff. And so my question to you, Caroline, is to be prepared when you meet with them to talk about how much, you had mentioned a revolving fund, how much per diem you would need for 40, let's say if they are asking to do the annual inspections. Well, how much is 40 inspections? How much, right? Or if they're only asking you to do code violations, can you project how many code violations you anticipate if there's 100 Airbnb, that kind of thing. So I would say I would recommend to go into the meeting with some numbers and also and I mentioned this to you already, I would quantify how many inspections you already do on a weekly basis and all the permit eyes, which is that app, the application that you have to look at every week to see what applications have come in, and to demonstrate that the Board of Health and to advocate that the Board of Health may not have the capacity. So my question to you is, what is your capacity for taking on more? We just talked about Susan maxing out at 19 hours a week and she still hasn't gotten through everything. And so I would just ask you, do you have the capacity to take on additional without having a revenue source or a per diem or a revolving fund? And then maybe go to the conversation recommending that there needs to be a per diem, way to, there'll be taxes raised from this, right? And so maybe some of that could go to pay for some of the inspections. Because I'm worried your staff doesn't have the capacity. You guys are already doing so much and you're already so stretched. So what do you think?
Well, I think I'll know more information when I speak to Michael White. That's what I think. Yeah.
I think Deborah's right, though. You don't have the capacity to do much more than you're already doing.
Right. Yeah, we'll have to see where this falls.
Mm-hmm.
Where's a lot of this falling?
Yeah.
It's it's a great thing to regulate the heck out of it and get it all together. But for it to be done by September, I think that's asking for shoddy work, because if it's something that needs a lot of research and numbers and statistics and stuff, it's just kind of throwing numbers out there. You need a lot of.
Can they do temporary regs and then work from them?
I have no idea.
Yeah.
Yeah, they're working with town council right now, actively. So.
Well, if you're interested in, I recommend watching the planning board meetings. They've been really interesting and helpful to really understand what are all the issues and how they're really being very thoughtful about trying to address them in the new bylaws. So, I mean, they can only do the best they can, but I'm glad you guys are going to be meeting. That's great.
Yes, I'm hoping to meet this week. More discussion. Next is public health nurse Susan Poirier. She's pursuing a reclassification of her position. So Susan would like to go from a level 6 to a level 8. You know, over the last few years, not only has her workload increased significantly, but there's other staffing in the health department that have come in at higher levels than Sue, the health agent, the assistant health director. And she's a well-seasoned public health nurse. You know, things are more complex over the past number of years, whether it has to do with the camp requirements, which the state has had the camp regulations more than once. They've added more things in the camp regulations that Sue has to ask more questions. Like recently, heads up that they have to do concussion training and things like this. There's more regulations in the camp regulations. So she's having to ask more questions and get more answers from the camp operators. In addition to some of the food-borne illnesses, she's having to, and this is no lie, spend 30 minutes talking to a person who's had like a food-borne illness and getting all the data. She's had to, you know, a lot of this was on paper when she started around the vaccines and stuff. So learning new programming, we had to learn the color platform through the, when COVID hit, and entering all the data in electronically. So she's had a big learning curve around that. She also is the animal inspector, so she took that on. I'm an animal inspector, so is Carolyn, but she's just one more animal inspector in the office helping with our animal dog bites, because I don't know what's going on in the health department. There's so many dog bites. Carolyn can go like this. And they're becoming more complex too. So we're having lawyers contact us about dog bites. We had a dog bite recently. The dog went to Connecticut. There were so many different steps that we had to take when the dog had to be quarantined in Connecticut and be released in Connecticut. And this isn't just a little, you know, one or two things we're finding out about dogs. We have to do all this reporting electronically about the dogs, follow up with the owners, go and deliver the quarantine orders. And so there's been a lot of more things that Sue is doing and more complex things that Sue is doing. So she can request this reclass of her position. And I've encouraged her in the past to do this. I know when I went for my reclass, the board was behind me and said, yes, you should go for the reclass, because there's so many different things. Every year there seems to be something different, but that I'm doing that I didn't do 10 years ago when I first started, or more than 10 years ago, 15 years ago when I first started as the health director. There's some, you know, with the opioids and things, you know, different things. So she's doing a lot of different things and a lot of more complex things in her position. And so she's going for the reclass. So it's she'd like to get your support. I'd like to get your support around that. So we can have in our union, I think it's up to, is it three to five people, maybe three, that they can put forward, and they have to make the decision too if she can get a reclass and see if she can go forward. And then there's an independent consultant that will review your job description, see what's new or what, you know, do you have parity with other public health nurses in other towns, things like that too. They look at a number of different data points and to see like if you can reclass, and they'll decide. But the first step is getting the board support. And I hope that you will support Sue, because, you know, at her position at level 6, she should be higher than that. Absolutely.
Oh, absolutely.
Absolutely.
I
Absolutely.
absolutely has my support.
I second that.
I third that. She has my
Thank
support.
you. Yeah, Sue is, she's really wonderful. She really is. She really works so hard for the health department, for us, for all of us. She's great. And then I think lastly, I'm going to go back to the goals and accomplishments. So in October of 2025, we set our goals and accomplishments every year, and we send it to Nick, town administrator, send it to the board. The warrant committee gets this, and every year if you look at it, I think it looks great. We're accomplishing a lot. We're following our community health improvement planning process. We have a number of goals that we're moving forward with, the standard operating procedure manual that we're working on all the time. We introduced the food program, the food bags. Ann's working with that. There's a lot of different moving parts. That one of the most celebrated that I love is the newsletter. So just this year, rolling out the newsletter and making people aware that what we're doing in the health department. So there's a lot of different things that we are working on. Another one here, utilizing the language line. And actually, Carolyn, you used the language line last week with a complaint about some chickens. So you were able to call up the language line and converse with the resident to tell her what needed to be done. So all of these things are, we're always adding to our list of our accomplishments and goals. And as I said, this came out in October 31st, 2025, and we'll put out another one next year. But for fiscal year 27, which we're in now, so that started July 1st. And then goals for FY 28 to FY 31, again, following along on our community health improvement plan, reassessing in FY 30, but building better relationships, providing more educational opportunities, exploring more opioid abatement, fundings, how we can help residents through that with the opioid abatement monies. So I don't think you saw this, Deborah. So this is what we've come up with for FY 27 and some of the goals. So I don't know if board you have anything you want to add to that.
First of all, it's just unbelievable, and it really drives home how much you guys do, the health department, and how you really have so much. You have limited capacity, and I mean, one of my goals as a Board of Health member is I really want to help look at ways to get the health department more capacity, because it's just in the packets, just for anyone's watching this at a later date, there's detailed report backs of all the accomplishments of all of the programs and grants, and it's really very impressive. But I'm wondering, do you usually include this, or are you including it because I had asked to talk about goals and planning?
Because you asked about it. I mean,
Okay.
I'm putting it in here because you may have not seen it. I don't think you saw this. So sharing it with you, Deborah, so you see what we're doing.
Okay, so I think that there was a misunderstanding. It's and really it's a funny thing that we can't talk to each other, Laura and Mary, outside of this meeting because of open meeting laws.
Right.
And so I think there was on probably my part miscommunication. So what I meant is I would really love to have a chance to do Board of Health planning for the year, because the health department is the staff that makes the miracle happen, the engine run. But the Board of Health is a separate entity, the three of us. And so I wanted to put on the agenda to ask you all if you might consider having an opportunity to set aside time. And it might not be most efficient to do it during one of these monthly meetings, or it might make the most sense to do it, schedule it like a retreat or a planning session, get together for a few hours and really talk about, do we as a board have goals, any planning goals, anything that we want to achieve in the coming year as the Board of Health, not the health department. So an example might be, I think it might be interesting to really talk about capacity, Caroline. It still amazes me how much you do with so little, and that maybe the Board of Health might want to put on its list for goals or planning is to really talk about or look at getting you more capacity or staff or help or support or whatever it is. I mean, there's a bunch of things that were said today. And so really what I meant was the planning for the year for the Board of Health goals and objectives. I know Select Board has a retreat, and I know Planning Board also takes time. They took time in the first meeting of their year to do their goals and objectives in the meeting. So there's different ways we can do it. So I wanted to put on the agenda to talk about if this group wanted to set aside time for goals and objectives for planning for the year for Board of Health, not Health Department.
Well, I feel like what happens in the for the board is driven by what's happening in the health department. And we're really overseeing what they're doing. And so I guess, like, I could say, oh, well, I think we should have this happen. But if they're too busy because they're getting done everything that is happening, that, if I'm making sense, I don't know.
Yeah.
It's just, I feel like we're
Do it like synchronously instead of like asynchronously.
right. We're driven by what's happening in the Board of Health, at the Board of Health Department.
So you're saying that
We established, oh, sorry, Deb.
No, go ahead.
We kind of like have goals that are ongoing and we carry them over and we resolve, we kind of do things from meeting to meeting.
Okay. So there are a lot so for example, the National Association of Local Boards of Health says that boards of health have 6 functions: policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and oversight. And so I thought it just might be good to set aside time if there's anything that we as a board wanted to. I mean, I have a lot of ideas and a lot of things I want to talk about and ask about, but I don't want to take up time during one of these meetings. So just
Well, I
suggesting
think
planning.
I think we would have to do it in a meeting. I mean, it has to be open. You know what I mean?
Actually, if we did a retreat, a planning retreat, the bylaw excludes a planning retreat. So it wouldn't have to be during one.
But couldn't it be just during one of the meetings? Is there a problem with that?
No. Planning board did it during the meeting.
Yeah, I mean, I think that would be the easiest way to do it. Well,
Yeah.
maybe we could set up something when we aren't expecting a heavy agenda. In the
Well, that's
next
why I was
couple of
thinking
months.
to do it at a separate
Yeah.
time because it's always a heavy agenda. It's
Yeah, well, not
talking
always.
for 2 hours. Yeah.
Um,
Like for example, I think Select Board for their planning, they put in, like, the different Select Board members put in their ideas to goals and accomplishments for the year. And then they had a facilitator, I think they had a former Select Board member, actually. Planning Board, you could even just watch the Planning Board session. They talked about what they wanted to achieve for the year, and then they came up with sort of things they wanted to work on. So I think that if we were to do it during these meetings, it would have to be in my mind, maybe a standing agenda item for a few months, a few meetings, maybe 2 to 3 meetings to get through it all, because it's a lot. And I don't, which is fine too. I mean, we could do it I mean, another idea is get a facilitator, have somebody walk us through, strategic planning, like a mini session, a couple of hours. I mean, there's all different ways to do it.
Well, let's think about it and think about which way we'd like to do it, and we can discuss it again at our next meeting and make a plan to do something.
Great. That'd be awesome. I appreciate that. And also part of the planning session that I have in my mind, why I don't want to sort of take up the time here is, the process for agenda items. We don't sort of see the agenda items until one business day before our actual meeting. And so, maybe spending time to think about different ways that we could, tackle that. Like at the end of every meeting, maybe brainstorm agenda items for the next time. So you have a base, Laura, you don't have to start from scratch, right? And then maybe add on as it comes up, right? Like as health department stuff comes up. So that kind of thing.
Mm-hmm.
So some of it is process, some of it is administrative, some of it is of substance, right? Like I have, I like the opioid stuff, the opioid funding. We might want to, revisit that. There's tobacco-free generation legislation that's pending at the state level that's actually going to impact us. There's like the Milton Coalition sustainability plan, that the coalition's, the DFC, Drug Free Communities Grant, is ending in a year and a half or whatever, the year after next. So maybe the Board of Health wants to talk about what the plans are for sustainability. I mean, there's so many things. So some of it is procedural or administrative, and some of it is of substance. So yeah, that'd be great if we could put that on the agenda for next time. And Laura, if I understand you correctly, it's not to actually do the planning next time. It's to talk about how we might do, if we wanted to do it, and how we might do it. Okay.
Yes.
That sounds great.
Okay. Future meeting date? Oh, wait, is there anything else?
Mary, are you all right with that?
Oh, yeah. Yes.
Are we all set with this? Was there anything else in your report? No. So future meeting date in September?
Yeah, and also we have to follow up with a couple of other things. I think we have to follow up with what town council says about
Right.
the medical advisor position, and also follow up regarding that letter, the sanitation code letter,
Right.
in terms of the language.
Yes.
Were there other things we were going to, I was going to report back and tell you what I found out from Noreen Dolan.
Oh, right. Yes.
Yeah.
Well, that will all be
part of
on
the
the agenda. Yeah.
Yeah.
So September.
And the follow up around the opioid grants. Talk to.
Yeah, I think someone mentioned, and it's true, I think we should have that on the agenda.
Yes.
Every month.
Like as a standing.
Yes, a standing.
Oh, that's a great idea. I like that.
All right. So the 7th of September is Labor Day.
The 14th. Does the 14th work for anyone or everyone?
It works for me.
Work for you, Deborah?
Yes. Thank you.
Caroline, does it work for you?
I think that it does. I'm looking at my calendar now. Yeah, I think so. Let's make September 14th. Do you want to do it at 7?
Yes.
And are we still going to meet by Zoom?
What does everyone want to do?
I can do Zoom. Zoom's,
Easier. Okay. You- I'm good either way.
Oh.
So,
Sounds
all right.
good.
Okay. Then
I-
I'll see you.
I do
Oh.
want to put something up just before as we're closing. We're going to have the International Overdose Awareness Day on September 20th, just to put it in your calendars. It's on a Sunday.
Okay.
I believe you'll see some flyers coming out. It's going to be in the morning on that Sunday. I'm not able to, unfortunately, attend as I'll be watching my new grandbaby because my son-in-law's his sister's getting married, so I'm going to be
Oh,
watching
nice.
the baby. So
Can
I
I
can't-
can I throw a monkey wrench into that date? That's a major Jewish holiday. Like the most it's the
what's that?
biggest Jewish holiday of the year. Yom Kippur.
What's the name of it? The Jewish
Yom
holiday.
Kippur.
but
That's
this
not
is-
on my-
But did we pick this date?
no, we didn't. No, we didn't.
It's
pick
an
that.
international day.
Right. So, they picked the date. So it is the people that are, and who I say the people are like Mary and Elaine, and Robin, Houston Bean, has picked that date. So I'll let them know that. I did not know that. They were looking for a number of dates and they settled on that date. So I will
Yeah,
have to
well,
let them know that.
yeah, good idea.
And when does that start? Is it
So
all day long?
so it starts at sundown on Sunday the 20th.
So it starts at sundown.
And then the next day is the first full day of it.
But would it impact it if it's in the morning?
Oh no. Oh, I thought it was an evening event.
No, it's a morning event.
Oh,
Oh,
okay.
Yeah,
Oh,
it's
that's great.
about 10 o'clock in the morning. Okay. So it wouldn't impact.
That's funny.
Okay.
It's a morning thing.
Yeah,
Yeah.
it's a morning thing. I guess it's a butterfly release. So they
Oh,
do it in the
really?
morning. Yes.
it mustn't get that many people, Caroline, on that in the morning on that day. Would it? I mean,
Where is it?
That's the date. They went over dates, and that's the date that they settled on that was the best for
But
them.
where is the butterfly release?
Going to be at the town hall, right at the gazebo.
Oh, okay.
Yeah.
mhm.
Can I ask something? Has the Milton Coalition been consulted about this, the date? Like to get
I have no idea. You know what, I'm leaving that up to Anya in Berlin, Mary and Elaine. So I think the last Milton Coalition meeting, it was before they're making their decisions. So they probably haven't even, or they're just working on the flyer now. They probably haven't been even asked about it, but I don't know the answer to that. I don't know the answer to that.
So if you could just ask them how they're planning to engage the coalition in this planning.
Yeah, because they're working with the coalition, so I will ask them.
I'm on the coalition and
And you didn't get engaged, so yeah.
no. I mean, in fact, the last meeting was a training and then the meeting before that was canceled. So we haven't had a meeting in many months.
Yep. So
Okay.
I'll ask them to reach out to Milton Coalition. All right.
Thank you so much. Thanks, everybody.
All right. Well, we'll see you in
So
September, right?
Can we vote to close the meeting to adjourn it?
Yes.
Laura, do you want to make that at 9:21?
I move to adjourn the meeting at 9:21.
Thank
I
you.
second that.
Good night, everybody.
Bye-bye.
Bye-bye.